And so, on the occasion of Mental Health Day, we also have with us Dr. Kshitiz Murdia, who is an IVF specialist, and he is the co-founder and CEO of Indira IVF, which is one of the largest IVF networks, in India. Dr. Murdia, welcome to the show. I want to start off by asking you now. IVF is a lengthy process. It involves, quite a lot of financial liability on the part of families. It can also be quite emotionally draining for couples. Now, as a doctor, how do you ensure the emotional and mental well-being of couples and families that come to you?
You've touched a very important topic of mental health, and especially so very relevant in infertility, because having a child is one of the biggest dream for couples in India. And when they suffer from infertility, it not only brings about stress and anxiety about not having a child or completing a family, but it brings about a lot of societal pressure, a lot of low self-esteem, I would say. And there is a background of marital discord, some domestic abuses, broken marriages, divorces. And so it's a big mental issue when it comes to infertility. And I think it's our duty as a doctor, as a gynecologist, as an infertility specialist to provide that mental support or that tool. And rightly so, because though infertility is a medical disease and we have medical or scientific treatment options available, unfortunately, the treatment options of IVF have not reached to a level where we can give 100% success to the couple. So knowing all these things, that they're suffering from infertility, already have gone through a lot of emotional and mental stress back home in the society, in the family, coming for a treatment, it's an expensive treatment. You're getting financially also challenged to meet up the overall requirement. And then on top of it, knowing that you might not get a successful outcome through it. So I think it's not just the initial part of the consultation or counseling. There has to be a continuum of counseling the couple throughout the treatment. One, to make sure that they enter into the treatment process, identifying what are the gaps, what are the opportunities, what are the treatment options available and how they go forward, but also post the treatment, because it's very, very important to handhold people once they conceive or not conceive, allay all the anxiety, fear, frustration if they don't conceive, and make sure that they are able to cope up with that stress. So I think it's very, very important compared to any other healthcare stream, especially in infertility, that you handhold the couple right from the entry point and even after they get pregnant or not get pregnant through the IVF process. So we have special counselors in the clinic. We also impart all doctors some counseling trainings, because as a doctor, I know we've not been given that education while graduating or post-graduating through the medical school on how to counsel the patient efficiently. But I think that's where we bring in all the training required at the very basic level of how to talk to the patient, how to understand the pain points, how to address all these pain points, and what to expect. I mean, if a patient fails, what would they be going through in their head, and how to counsel them and manage that stress effectively. So that's a very important part.
Doctor, you've touched upon some really important points in what you just said, that not only is it emotionally and financially draining, you might actually not be successful, because at the end of the day, these are processes which are actually 100% in nobody's hands. Now, I want to ask a related question, which is that, when I became a mother 10 years back, what I really missed was support groups. Whereas, my friends who were living in the West, that was very common to have these support groups for pre-pregnancy, post-pregnancy, if you were trying to conceive and not successful. Now, as a doctor, now the patient is at your clinic for a limited amount of time, and you yourself, as you said, are doing your best. But how do you have any way to educate families or groups or support groups for a larger outreach in this matter?
Again, very important thing, because Western culture, it's very, very common, and I think it's a great means to make sure that you get comfortable through the entire journey. And in India, support groups are not so common, so it entirely rests on the doctors to create these small groups, share experiences across. And we do it in a very, very small and a smart, cheap way, to say that you come to my clinic as a new patient today. There'll be some patient who's come positive or negative, or who's already pregnant through the IVF journey in the last few months. They are also visiting the clinic. And we make sure that the new patients get a chance to interact with these positive patients or negative patients, where they can share their experiences. They can share the ups and downs in the journey, because IVF is a long process. It's a 2-3 month process. You might sometimes get good outcomes. Your follicles are growing well. You are responding well to the medication. Suddenly, you have a poor outcome, that whatever eggs we retrieved are not good quality. Then you again could have a better outcome, that your embryos are good. Then you can have a negative outcome, that the embryos are not implanting. So there are a lot of ups and downs during the entire journey. And I think creating that small environment at the clinic, where positive patients get a chance to interact with the new patients get to learn from the experiences of a positive or a negative case, either ways. I mean, it doesn't always have to be a positive case. I think that helps the new couple, one, to take an informed decision, second, to adjust to those emotional turmoils, of ups and downs. And the pregnant patients or the negative patients who are again going for a second round can share their experiences, their methods to cope up with this stress. I think that helps these new couples entering into the process in a quick way. The second thing that we do is a counseling session. So although as a patient, when you walk into a clinic, you have this one-to-one counseling with the doctor, but we also take a group session where we have all the patients being taken into a common room, and we discuss generally about infertility, what are the causes, what are the treatment options, because sometimes some patients feel shy talking about, in person also. They might be listening in a group. Some people are asking 10 questions, 9 of them get addressed. So it's a group session, it's a one-on-one counseling session, and then creating that community sort of environment in the clinic every day. And that we do every day. Every day there'll be some positive patient in the clinic. You just have to announce and keep reminding the other patient that these are positives. You can talk to them, listen to their journey as to why they were infertile, what were the causes, 10, 20 years of married life, and how they navigated the journey and all. So I think that is what we're doing from ages. I mean, when we started, and that has given a big difference in, counseling the patients, and they themselves feel very motivated to go through the process.
Doctor, thank you. Your clinic really, as I'm listening to it, seems to be a bubble of positivity. You are talking about some very relevant things like pain points, like having support groups, and also about people's shyness, especially in a country like India, to just speak up openly about some things. Now I'm going to come to another related topic again. As I said, I'm a mother myself, so I've been through the journey and completely identify with the things that you're saying. Now, what about postpartum depression? For instance, you do IVF. Now, after birth, you don't, your responsibility kind of, I'm sure, goes a little bit ahead also. So, suppose there is postpartum depression. This is something which women and families just take it as, ye to hota hai types, they will get over it. But we don't address it as a matter of discourse. What would you like to say about postpartum depression and how women and their families can address it?
Sure. See, any mental health issue, and I'll come to postpartum depression as well. Any mental health issue, I think, is gaining increasingly more and more importance, and rightly so, because one, if you're aware that these kind of issues can happen to you also. I mean, no one is immune to a mental. I mean, if I don't get something that I don't, I want to, I'll get into some sort of depression as the day ends, right? So identifying, one, that anybody can get affected, identifying that it's a normal thing to feel depressed or anxiety or something, and addressing it very proactively. I think that is very, very important. So again, postpartum depression is a very common thing. 1 out of 7 females suffer from it. It can happen anytime within the first 1 year of birth. Mostly happens in the first few weeks. You can feel sad, you can feel hopeless during the day, you can feel detached from societal things. You don't want to talk to your family or friends. You sometimes feel detached from your baby as well. You don't want to, have the baby near to you, or sometimes you might experience these anxiety and panic attacks, and it's entirely normal to go through the all the changes that I've mentioned in the postpartum period. Again, identifying, being aware of it, identifying the earliest signs of all these three or four things, and seeking proactive help. I think this could immensely help mothers, who are going through it. And as you said, I mean, people know that this happens, ye hota hai, but I think we need to proactively address it, and then things could be very better. As simple as it. If you don't feel good in a day, you've not done something, and somebody listens to you, talks to you in the evening, you feel a lot better that I've let out my things. Somebody is listening to me. Somebody who's gone through that is telling me what to do, how to cope up with this emotional turmoil. I think that helps a lot.
Absolutely, and I think previously we used to have large joint families where there were mothers and aunts. I think now increasingly, our doctors, the whole idea of a doctor has increasingly changed. Doctors are increasingly doing more of counseling, more of compassionate action, which I'm sure, I mean, you do at your end. So my last question to you today is that how important do you, while I'm sure you're talking about it all the time, or some others like you, but how important is it to have these plug points like a mental health day or a World Health Day, where we actually stand up and we talk more about these issues, or we celebrate motherhood more? How important is it to do that?
See, this is something which everybody has to do every day. It's not one day in a year that we do this, but these are occasions where we talk about it the whole day. There are numerous articles being published. It's basically a reminder to people that something of this sort exists, and you should be careful on it. I mean, keeping as you take care of your health physically, I think there's an emotional or a mental aspect of also to the health, and I think that impacts to a great extent. More than physically you get affected, you feel pain somewhere, you can identify and isolate that pain to that particular body part, and you go after correcting it. I think it's very, very important to be mentally also healthy. And I think with these occasions on Mental Health Day and talking about womanhood and mothers and infertility and all the mental stress associated with that, I think it's a great way to bring about this topic, have this topic being discussed openly, because there's a lot of social stigma and taboo still around, not just infertility, but also about mental health. People feel, are we going mad? Do we have to go to a psychiatrist? Why should I go and consult a psychiatrist? There's nothing bad in it. You're not mad. But these are normal emotions that every person on the earth would go through. So it's a good reminder that these kind of things can exist, can happen to you. You should seek proactive help, seek the expert help, and that's it, and feel better. I mean, as good your mind is, you will feel physically also much better.
Thank you, Doctor. As Dr. Murdia just said, that not everyone is going through the same thing at the same time, or perhaps you are and you're just not aware that others are going through the same thing. So it's very important to have these reminders. And today, on the occasion of Mental Health Day, we are doing this day-long conclave. So do please listen in and be a part of this initiative. Thank you very much. Hello, today we have a very special guest with us here, Mona Agrawal, a Paralympian who did us all very proud at the Paris Paralympics with her winning the bronze medal. Mona is here with us on the occasion of World Mental Health Day, and we are doing a mental health conclave here today on Revsportz. Mona, today I'm going to talk to you about mental health issues around pregnancy, because you are a mother of two kids. They are RV and Abhik, if I'm not mistaken. And I want to talk to you about being an athlete who is also a mother, and what that entails. What are the mental issues involved when you go through pregnancy, when you have kids, and at the same time you want to keep playing your sport. To start, tell me, when you got pregnant the first time, you were going to be a mother, and your daughter is your older child. RV is your older child. So when you got pregnant with RV, now we are all used to looking after ourselves, including you. And I know that you have been a very independent girl. You left home very early. But when you were going to have your child, आपको कभी ऐसा लगा था कि मैं अपनी देखभाल तो कर लेती हूँ, लेकिन मेरा एक डिसेबिलिटी है? You had polio when you were 9 months old. हाउ विल आई डील विथ मदरहुड? कैसे मैं अपनी जो बच्चा आएगा मैं कैसे उसकी देखभाल करूंगी? ऐसा आपको कभी लगा था?
बिल्कुल लगा था, क्योंकि जब मैं फर्स्ट टाइम प्रेग्नेंट हुई थी, फैमिली में सबके साथ डिस्कशन हुआ था, और इट वाज लाइक कि अगर प्रॉब्लम हो रही है और तुझे लगता है स्टार्टिंग के 2-3 महीने में, तो हम लोग उसको अबॉर्ट करवा के और फिर हम लोग अडॉप्शन पे चले जाएंगे, किसी चाइल्ड को अडॉप्ट कर लेंगे। बट प्रॉब्लम में आने के लिए, मतलब प्रॉब्लम लेने की जरूरत नहीं है। अगर कंफर्टेबली वो हैंडल होता है तो ही हम मतलब बर्थ ऑप्शन पे जाएंगे, अदरवाइज हम बच्चे को अडॉप्ट कर सकते हैं। तो मेरा ये था कि नहीं, मुझे मेरा खुद का बच्चा होना चाहिए, क्योंकि वो मातृत्व की फीलिंग जो आएगी वो उसी कंडीशन में आएगी। तो शुरू के 3 महीने ऐसे थे कि बेड रेस्ट करना है। अब क्योंकि मेरे अंदर वो खिलाड़ी भी था, तो बेड रेस्ट करना मुझे अच्छा नहीं लगता था, लेकिन ये भी डर रहता था कि अगर मैं कुछ भी काम करूंगी तो कहीं बच्चे को कोई चोट ना लग जाए, क्योंकि हमारा चलना फिरना वो सब नॉर्मल पर्सन की तरह नहीं होता है। तो ऐसे लगता था कि कहीं गिर गई तो कुछ चोट ना लग जाए, कोई मतलब, क्योंकि जिस डिसेबिलिटी को मैं बचपन से फेस करती आ रही हूँ, मैं नहीं चाहती कि मेरी एक छोटी सी भूल की वजह से मेरे बच्चे में वो डिसेबिलिटी आए। तो मैंने पूरे टाइम, अगर मैं कहूँ कि आरवी के टाइम या अविक के टाइम, 9 महीने तक अपने आप को भगवान के अंदर लीन रखा था। हर मोमेंट पे अपने आप को भगवान को मतलब रिक्वेस्ट करती थी कि भगवान जो मुझे लाइफ दी है ना, मैं उससे खुश हूँ। ऐसा नहीं है कि मुझे उस लाइफ का अफसोस है, लेकिन मेरी किसी गलती की सजा मेरे बच्चों को ना मिले। उन्हें ये लाइफ अगर उनकी डेस्टिनी में होगा वो उनको मिलेगा, लेकिन मेरी वजह से उनको ये लाइफ ना मिले। तो बस उतना बचा के रखना कि जब तक वो मेरे अंदर है, मैं 9 महीने उनका ध्यान रख रही हूँ, तब तक मैं एक अच्छी माँ बन सकूं कि मैंने उनका अंदर ध्यान रखा। बाहर आने के बाद पूरी फैमिली को मिलके ध्यान रखना है, मेरी अकेले की रिस्पॉन्सिबिलिटी नहीं होगी। और इस दौरान कई बार ऐसा हुआ कि मैं गिरी, क्योंकि मैं पहले कैलिपर पहन के चलती थी। तो जैसे जैसे मेरा वेट बढ़ता गया तो मैं 2-4 बार गिरी, और वो बहुत जोर से गिरती थी। घर में सबको ऐसे हो जाता था कि पता नहीं अब क्या होगा। और जितनी बार मैं गिरती थी, फिर मैं उतनी बार डॉक्टर के पास जाती थी और डॉक्टर को बोलती थी अच्छे से सोनोग्राफी करो और चेक करो बच्चे को कोई चोट नहीं लगी है। तो शायद मैंने 5 या 6 बार सोनोग्राफी भी एक्स्ट्रा करवाई होगी। आई नो सोनोग्राफी कराने से जो उसकी रेज है वो भी बच्चे के लिए हार्मफुल है, बट मेरे अंदर का वहम ऐसा था कि मैं गिरी हूँ, क्या पता बच्चे को कोई चोट लग गई होगी। उसके अलावा ऐसे था कि डिलीवरी वाले दिन जब मैं ऑपरेशन थिएटर के लिए जा रही थी, तो डॉक्टर से मैं बार बार यही कह रही थी कि बस बच्चा सही सलामत होना चाहिए, बच्चा सही सलामत होना चाहिए। उसको जो भी वैक्सीन वगैरह देने हैं आप वो टाइम से दे देना, उसको वो प्रॉब्लम नहीं होनी चाहिए जो मुझे हुई है। तो
और ये बर्थ से पहले है जब आप डिलीवरी के लिए जा रहे थे?
हाँ, तो जब मेरा बेबी का बर्थ हुआ, आरवी का बर्थ हुआ हॉस्पिटल में, तो आजकल खाली कमर के अंदर जो इंजेक्शन देते हैं उससे आपको होश रहता है, आप बात कर सकते हैं। तो मैं कंटिन्यू डॉक्टर से बात कर रही थी, तो जैसे बच्चे के रोने की आवाज सुनी, मेरे आंसू स्टार्ट हो गए थे। डॉक्टर ने पूछा कि पूछोगे नहीं क्या हुआ है, बेटा हुआ है या बेटी हुई है? मैंने कहा नहीं, आप खाली इतना बताओ जो भी हुआ है वो एकदम स्वस्थ है। तो डॉक्टर ने कहा कि एकदम राजकुमारी सी बेटी हुई है और वो एकदम स्वस्थ है, उसे कुछ नहीं होगा, ये मेरी जिम्मेदारी है, तुम टेंशन मत लो। वो सुनने के बाद थोड़ा सा मुझे जैसे हिम्मत आया। इवन आफ्टर बर्थ भी जब आरवी थी तो ऐसे लगता था, क्योंकि मुझे बर्थ के बाद 9 महीने के बाद पोलियो हो गया था, तो मैं उसकी वैक्सीन्स का, हर चीज का बहुत डीप ध्यान रखती थी कि कोई भी चीज मिस नहीं होनी चाहिए। डॉक्टर से 10 बार पूछती थी कि ये वैक्सीन ये सही है ना। मैं खुद उस वैक्सीन की डेट्स वगैरह चेक करती थी कि नहीं कोई भी गलत वैक्सीन जो मेरे साथ हुआ वो मेरे बच्चे के साथ नहीं होना चाहिए। तो वो ट्रॉमा एक तरह का था कि जब तक बच्चे अभी थोड़े बड़े नहीं हो गए, अभी वापस से आया, तो तब तक मैं उसको झेल रही थी कि बच्चे सही रहने चाहिए, बच्चे सही रहने चाहिए।
तो मोना, आई एम ऑल्सो अ मदर, और जब मैं आपकी बातें सुन रही थी तो आई वॉज ऑल्सो थिंकिंग बैक टू माई ओन प्रेगनेंसी, एंड एवरी मदर गोज थ्रू द इमोशंस दैट यू हैव गॉन थ्रू। और एडिशनली आपका एक जो चाइल्डहुड का ट्रॉमा था, आप नहीं चाहती थी कि मेरे बच्चे कैसे भी हो अफेक्ट नहीं होना चाहिए। तो this is a sentiment that I think all mothers will understand and they will identify with. But आप ये बताइए, एक तो है कि जब मैं आपको सुन रही थी, obviously there were emotional highs and lows throughout कि मेरा बच्चा सेफ होना चाहिए, जो मेरे साथ हुआ उनके साथ नहीं होना चाहिए. In addition to those issues, and obviously that affects pregnancy. I mean that that affects how you're going about your day-to-day thing. But आप तो खिलाड़ी भी है. So how did you think about after pregnancy, how am I going back to my sport? Because if I understand that you were not allowed much movement during pregnancy, so did you think that after pregnancy मैं कैसे लौटूंगी अपने स्पोर्ट में?
एक्चुअली वो पता था कि बहुत सारे हेल्थ इश्यूज होने लग जाते हैं प्रेगनेंसी के बाद, और ये भी पता था कि मेरे जो भी बच्चे होंगे वो सिजेरियन ही होंगे, नॉर्मल डिलीवरीज नहीं हो सकती। तो सिजेरियन वाली कंडीशन में आपको बैक पेन और इस तरह के कई इश्यूज हो जाते हैं। आपका टमी फैट जो है वो एज इट इज रह जाता है, तो उसकी वजह से आपका वेट पुट ऑन हुआ। वेट पुट ऑन होने के बाद में फिर मैं मतलब मुझे चलने फिरने के लिए अभी दिन पर दिन इश्यूज होते जा रहे हैं। तो वो एक फेज था, लेकिन मुझे इतना ट्रस्ट था, मैंने डॉक्टर से बात की थी कि मैं उन चीजों को कंट्रोल करके और कैसे करती हूँ। तो मैं कंटिन्यू मेडिटेशन भी करती रही, और मैंने मतलब अपने आप को हेल्दी रखने के लिए मेंटली या फिजिकली मैंने मैंने दोनों चीजों पे अच्छे से काम किया था, जिसकी वजह से शायद मैं कमबैक कर सकी थी।
तो आप अभी भी मेडिटेशन करती हैं along with any other exercise that you may do, physical exercise?
मैं मेरी शादी से लगभग 2-2.5 साल पहले मेडिटेशन करना स्टार्ट की थी, जब मुझे मेडिटेशन का मतलब समझ में आने लगा था कि कितना इम्पोर्टेंट है। तो शुरू में 1-1.5 साल शायद मुझे नहीं समझ में आया कि मेडिटेशन हो रहा है या नहीं हो रहा है। इट वाज लाइक कि मेरे को 1 घंटे बैठना है, उस पोजीशन में मैं बैठूंगी, थॉट्स वगैरह आते जाते रहते थे। लेकिन वो धीरे धीरे अब मुझे फील होता है कि अगर मैंने किसी दिन खाना नहीं खाया है तो कैसी फीलिंग आती है। सेम फीलिंग आती है मुझे कि जब मैं 10 मिनट चाहे 15 मिनट बैठूं, मैं मेडिटेशन में अगर नहीं बैठती हूँ ना, तो मेरा पूरा दिन ऐसे रहता है कुछ मिस कर दिया आज मैंने। तो वो मेडिटेशन मेरे लिए एक डोज है जो मुझे पूरे दिन एनर्जेटिक रखता है।
Excellent. And I also meditate. And do you think for an athlete to be in the right mental frame, whether you're a mother, whether you're going through pregnancy or other issues, it's very important to meditate to be in that mental frame?
डेफिनेटली बहुत ज़रूरी है। मेडिटेशन को आप एक तरह से ये कह सकते हैं कि आप अपने भगवान को याद कर रहे हैं, या आप अपनी भक्ति में लीन हैं। आप इसको किसी भी नाम के रूप में याद कर सकते हैं, कह सकते हैं कि मैंने मेडिटेशन इस रूप में किया। लेकिन ये बहुत ज़्यादा ज़रूरी है आपकी मेंटल हेल्थ के लिए, आपकी फिजिकल हेल्थ के लिए, ड्यूरिंग आपके स्पोर्ट्स के लिए, या ड्यूरिंग आपकी प्रेगनेंसी, या आपकी डे टू डे रूटीन लाइफ। क्योंकि डे टू डे रूटीन लाइफ में भी इतने सारे अप एंड डाउन आते हैं, इतनी सारी प्रॉब्लम्स और ये सब चीज़ें आती हैं। उन्हें हैंडल करना, उस मेंटल प्रेशर को हैंडल करके राइट डिसीजन की तरफ अपने आप को लेकर जाना, ये बहुत इंपॉर्टेंट होता है। और ये तब होता है कि आप उस प्रेशर के अंदर, एक्सट्रीम प्रेशर के अंदर भी सही चीज सोचने के लिए अपने अंदर वो कैपेबिलिटीज लेकर आते हो, और वो आती है मेडिटेशन।